Erectile dysfunction is inability of the individual to have an erection. The erectile dysfunction is a fairly common problem, and it can start as early as 40 years of age. The most common causes of erectile dysfunction are peripheral vascular disease, diabetes, but sometimes also performance anxiety in a new relationship, post-surgical causes of erectile dysfunction, especially after pelvic surgery. The first step in treating ED is looking holistically after the individual. We're looking at the general health of the individual. Is there a possibility that the patient has got diabetes, and then we can identify that and then possibly treat that? Is there a possibility that the patient has got peripheral vascular disease, and again address those issues for peripheral vascular disease or ischemic heart disease, and check the cholesterol, control the diabetes, try and lose some weight, and we're looking at the general improvement of general health of the patient. Once we've addressed the issues of the general health of the patient, we're looking at then medical treatment for the erectile dysfunction. And in terms of the medical treatment, the PDE5 inhibitors are the most common treatments used in regards to ED. From the tablet point of view, that would be the treatment. The next step in the treatment of the ED would be looking at penile injections, and that is a very effective way of treating ED. However, there are problems with the penile injections in terms of the possible side effects that they can cause, and also sometimes the mental hurdle that the patient has to overcome to be able to start injecting into the penis. In terms of other devices that we can use for ED, is a vacuum pump device. As you can see here, this is one type of a vacuum pump device that we can use. This particular way of having an erection, you would need to stop the erection after half an hour, and also the other thing that you need to be aware of is that it can cause a bit of bleeding at the tip of the penis, sometimes a bit of bruising. Hence, longer term, a lot of patients also end up with discontinuing the vacuum pump device as a treatment option, since it is much more artificial, and it does not feel like a natural erection. And a much more permanent solution in terms of dealing with the erectile dysfunction would be an inflatable penile prosthesis. The inflatable penile prosthesis by Titan is certainly a new prosthetic device that is being developed. It is a very good prosthesis, and it's very durable. It's a much better erection that patients get, and the satisfaction from an inflatable penile prosthesis is 95% to 98%. That is the patient and the partner satisfaction rate. The inflatable penile prosthetic device is a very safe procedure. It is done as an overnight stay in hospital, and it is a very safe procedure. The major complication rate is very low. There is less than 1% chance of having an infection of the device, which is, as I mentioned, a very low risk, and it hence makes it a very safe device to use. I'm going to show you now how we do insert the device. The device is basically inserted through a small incision, which is performed just under the pubic bone. This is the part of the device that goes inside the penile shaft. This is the part of the device that goes inside the scrotum, and this is part of the device that is inserted next to the bladder. When we do this, when we do the cycling of the device, and when the patient wants to have an erection, he presses into the scrotal pump, so this is now a fairly firm erection. The reservoir is deflated because the fluid now from the reservoir has gone inside the penile shaft, and patient has got a full erection happening. Once the intercourse has been completed, patient has to only press once into the side of the device, and the device will deflate by itself. Or if you want to get the device to deflate quicker, you just press on the penis like that, and you can see here the reservoir is filling now with water, and basically it goes back to a normal position. So it's a fairly natural, after the reservoir has been deflated, you get a very natural looking penis, and in a normal flaccid state. When we talk about inflatable penile device, it is a much more spontaneous erection than you would get with the injections or with the vacuum pump devices. The patient, when he feels that he wants to have intercourse, he does not have to insert injections into the penis. He doesn't have to use the vacuum pump like we mentioned before, with getting all the blood going into the penis, getting a blue penis happening, and also having the ring around the penis. And also, in fact, even if you're looking at tablets like Viagra or Cialis, in terms of spontaneity, I mean, often you can't get the erection when you actually want it, even with the tablets. So in terms of patients wanting to have the erection straight away, and at a particular time, with the possibility of the erection not happening, would be much higher with other forms of devices than with a penile prosthesis, because this would be at the erection at will. Erectile dysfunction is a common problem. If you do have a problem with erectile dysfunction, there are solutions to the problem, which can be short-term or long-term solutions. If the problem, however, is more long-term, there are solutions for the long-term problem with erectile dysfunction. The most reliable solution would be an insertion of a Titan inflatable penile prosthesis. Talk to your doctor about the problem, and then the next step would be a referral to a urologist that has got a special interest in erectile dysfunction and has got the expertise in performing a minimally invasive surgical procedure for inflatable penile pump devices.